Hello everyone, I am Sandra May Ibranyola from BSN 212E of Davao Doctors College. And for today's demonstration, I will be performing the female urinary catheterization, which allows urine to drain if you have any obstruction in the tube that carries urine out of the bladder. So I have here the equipment that I will be going to use. The set of catheter, kidney basin and scissors, lubricant, catheterization and a tape, sterile water, antiseptic solution, and waterproof underpad. So the first step we need to do is to check for the doctor's order for catheterization. This is to ensure that we have the right patient and the right procedure to be done. Okay, so next, washing my hands before preparing the set for catheterization is very important to reduce the risk of microorganisms that can cause diseases and contamination. Then, identifying the patient and explaining the procedure is very vital, for this will let the patient feel reassured of the procedure, and if ever it is explained, and if she is handled properly and considerately. So, good morning ma'am, I am Sandra May Ibranyola, your student nurse for today. Can you please state your complete name?
This is Dayan G. Erola.
Okay, your birthday and civil status please.
January 6, 2004, single.
Okay, thank you very much ma'am. But before I proceed, may I ask what should I call you?
Dayan.
Okay ma'am Dayan, the procedure that I am going to do to you is the indwelling of urinary catheter. This is to relieve your acute pain or chronic detention on your body. So, this means that I will be touching your genital area. Is that alright with you?
Yes, nurse.
Okay. So, do you have any clarification or questions that do you want to address?
None.
Okay, so I will just close the door before we start. Ensure to screen the patient or locks the door before doing the procedure in order to provide patient's privacy. Then position the patient in a recumbent position with knees flexed, for this would be a good visualization of the meatus to introduce the catheter. Okay, Ma'am Dayan, so I need your knees to be flexed. Okay. So make sure to put the urinary bag on the patient's bed frame. It should be at below waist level. Okay, so now drape the patient, exposing only the genital area. So, since we are not allowed to show a real genitalia, I have here a printed genitalia. I will just put it here. Okay, so draping the patient means minimum exposure, the lesser the embarrassment. So, of course, it is to provide warmth also. So, don't forget to place waterproof underpads to prevent the bed becoming soiled. Okay, so then apply a direct light for visualization of genital area. So this is to have a better visualization of the area. So open the tray. We have the tray here, and arrange your equipment for convenience and accordingly. So to avoid the contamination of the sterile item. So placing the equipment in order will increase the speed of performance. Also, reaching over sterile items increases risk of contamination. So observe for the sterility of the items. So we have our forceps here. Then we have our eye sheet, sterile gloves, and the cotton balls, betadine, and already filled injection with a 10 cc sterile water. So start with the start cleansing the genital area from the cotton balls with betadine, starting from the midline. So we have our kidney basin here. Then from labia majora, do it in the other opposite side. Then labia minora, so never restroke the cotton ball. So I have already opened the set and observed sterile technique. So what I'm going to do is to put on my sterile gloves in order to prevent contamination and to maintain the sterility of the set. So using the forceps, you put the eye sheet then after this, I'm going to put the catheter. So connect it with the catheter with a pre-filled syringe of 10 cc sterile water. So lubricate the catheter first for about 1.5 inches. Be careful not to plug the eye of the catheter because lubrication will help the friction and prevents urethral trauma, thus reducing pain upon insertion. So pick up the catheter at least 3 inches from the tip of the thumb. 3 inches from the tip of the thumb. Okay, so here. Then place the one finger on the left or right hand between the labia minora. So we'll just put our lubrication first. Okay, receptacle here. So separate and pull up gently. So separating the labia minora. Then by separating it, the area, the surrounding meatus will provide visibility. So insert the catheter into the meatus. Then for 2 to 3 inches or until the urine begins to flow. 2 to 3 inches. Okay, so if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen in the container in position. So urine will flow out of the catheter if fluid is not occluded. So rest the hand in the pubis area. We have our specimen here, specimen container. So rest the hand in the pubis area while holding the catheter in place. Holding the catheter in place. Okay. So withdrawing the catheter and pushing it back will only increase the possibility of contamination to the urethra. So place it gently and correctly. Okay. So let's connect it to the catheter of the urine bag. So here, uncap the urine bag so that the urine will not leak from the bag and maintain its sterility. So inserting the connector to the urine bag. Okay? So, inflate the balloon of 10 to 15 cc of sterile water using the syringe. So, make sure that there will be no leakage of water from the balloon. Thus, it serves the purpose of anchoring into the bladder. So, secure it and remember no leakage from the water. Okay? Withdraw the needle. Okay? Then place it in the receptacle area. So we have our receptacle here. So secure the indwelling catheter by taping it to the patient's thigh by using the catheter tape. So allow some slack of the tubing to accommodate the patient's movement. So allow some slack. So assuming that this is our thigh, okay? So to properly secure the catheter will properly prevent the tension in the catheter when the patient moves. So place the patient comfortably. Okay, Ma'am Dayan? So we're done with the indwelling of urinary catheter. So I will just drape over your genitalia so that you can have your proper privacy. So this will foster relaxation and comfort. So do not forget to do the aftercare and record the time of the procedure done, amount, and color of initial output. So cleaning the environment promotes comfort to the patient. So moisture is a good propagator for the environment for bacterial growth. So always remember that moisture helps the growth of bacterial growth. So for the documentation of urinary catheterization, we should always include the date, time of the procedure, and the type and size of the catheter used. So in my case, I use a two-way Foley catheter, latex silicone coated. Its size is 14 French. Also record the amount of fluid used to inflate the balloon, wherein I use the 10 cc of sterile water, and also document the character and amount of urine from the urine bag, the reaction and response of the patient, and also include other significant observations.